In this section we're going to continue talking about synchronization of estrus, but the focus is going to be on progesterone or progestogen based systems for synchronizing estrus in cattle. In this photo here we have a what's called a CEDA device, or a controlled internal drug release device. This is one of the commercial devices that you can buy that contains the hormone progesterone, and this is placed intravaginally in cattle to release progesterone. Here's some examples of some other ones. This is the Q-Mate device, which is similar to the Q-Mare device, which is used in mares, and these contain silicon impregnated plastic pods that contain the hormone progesterone, and these can be removed and replaced, and so this part of the device can be reused, and that makes them a little bit cheaper than, say, the CEDA device, which is discarded after it's used. There are some different types of CEDAs that are available. This is one type that has been traditionally available in Australia. This is the type that's available in the USA. This was an experimental type of CEDA that I did some work on a few years ago. It was called a PCL device, and it was biodegradable, but it didn't make it to the marketplace. This is the original intravaginal device called a PRID, a progesterone releasing intravaginal device, and this was the original concept. The loss rates of these devices from the vagina of cows tended to be greater than these CEDAs and Q-Mates, so these appear to be a better design, but this was the original device that was first brought out several years ago. Just for your interest, there's a device in women that's used for contraception that almost looks like a CEDA in its shape, and it sort of is. This contains a progestogen, and it's slowly released in the uterus. It's placed within the uterus of women, and it contains a hormone called levonorgestrel, which is a progestogen device. And this is slowly released over approximately a 5-year period, and while that device remains in place, it has a very high rate of preventing pregnancy in the order of 99%. It prevents, as in cows, the presence of progesterone, or in this case a progestogen, causes or helps prevent ovulation from occurring, thickens the mucus, so it helps prevent sperm penetrating through the cervix, and it also changes the intrauterine environment. So there's a number of factors working together there that prevents pregnancy. The only reason I've included that is just for your own interest. So progestogen-based systems for synchronizing estrus use mostly intravaginal devices, although in the past, I haven't shown a photo of it, silicon-based implants were used to put subcutaneously in the ears of cows. The reason I haven't shown you these is because they've been taken off the market. So the ones that we use are intravaginally placed, and when you place these devices in, they'll prevent ovulation and the onset of behavioural signs of estrus, because progesterone is having a negative feedback effect on secretion of GnRH, and so you don't tend to you don't get an LH surge while they're in place. At the end of treating with these devices, we usually provide a luteolytic treatment such as prostaglandin to get rid of any endogenous production of progesterone. So when you remove the device, give them a shot of an injection of progesterone, you'll get a decline in plasma concentrations of progesterone, and the cows will start coming in heat. Treatments are also used to synchronize emergence of a new follicular wave. So usually at the start of when you put one of these devices in, on the day of insertion, you'll also inject estradiol benzoate or GnRH to try to synchronize the emergence of a new follicular wave. Following the end of treatment, treatments may also be included to synchronize ovulation at the end of treatment. So you remove the device, and then a day or 2 days later, sometimes 3 days later, you'll give an injection of estradiol benzoate or GnRH to try to induce ovulation. One of the advantages of these treatments is that many cows that are anestrus, that is, they're acyclic, they're not ovulating, these will be induced into estrus, and ovulation will be facilitated in these animals. So if you're using, if you've got animals that you think some of them aren't ovulating at the time of treatment, then you will be able to induce many of them to come in heat with this treatment. So there's a distinct advantage in the use of these devices. Now I should just say that there's a differences in the depth of anestrus between animals, between cows. Animals that are very deep in anestrus, that is, they may be very skinny, they may be short interval postpartum, these are more difficult to induce to ovulate with progestogen treatments. Animals that are gaining weight, they may be 40-60 days postpartum. There's an increase in positive energy balance within these cows. These cows are much easier to induce to ovulate with these progesterone treatments. So they're not perfect, but they are pretty good in facilitating animals that are not cycling to come into estrus following treatment. Now if you're just using prostaglandins just alone, then we remember back from our prostaglandin notes that they'll have no effect on inducing estrus in cows that are not ovulating. So here's a distinct advantage for the use of progestogens to increase the proportion of cows that are ovulating. Once these devices are used, they can be reused, usually at least once, and in some cases up to on three occasions. But usually we just use them once and then maybe reuse them once and then discard them. If you're going to disinfect them, first of all you need to clean them, so you need to clean off all the mucus and the junk. And one good device for doing this is just a washing machine. You place them in a washing machine, put some white king or some hypochlorite bleach solution into the water to try to kill any bacteria. You can also use disinfectants such as Virkon. I tend not to use a soap-based disinfectant because some of the soap might remove some of the hormone from the device. So I usually just use a chemical disinfectant. Once you've disinfected the devices, you then rinse them with water, dry them, place them in a black bag to protect them from light and dust, and then you can use them again on a subsequent occasion. I've used them up to 3 times. I was doing some research at one stage where we got them analysed for their hormone content after the 3rd use, and in dairy cows, by the time you'd used them 3 times, there wasn't a lot of progesterone present. And even some cows on the 3rd reuse, some of them would actually come in heat, which suggests that the amount of hormone that the device was delivering was almost completely depleted. This is just a typical graph. When you insert these devices, you'll get a rapid rise in concentrations of progesterone, and concentrations will steadily decline until they're removed. Once they're removed, you'll get a rapid decline in concentrations of progesterone, generally within 12 hours of removal. Here's an example of a protocol. This is the type of thing you should be able to explain at the end of these lectures. So here I've got an intravaginal device like a CEDA or a Qmate that I've inserted, in this case for 7 days. I'm giving an injection of estradiol benzoate here, prostaglandin at the time of removal of the insert, and then 24 hours later the cows are getting an injection of estradiol benzoate, and then they'll be inseminated on detection of estrus out here, or they'll be inseminated at a fixed time following injection of the estradiol benzoate. So how does this work? First of all, by inserting the CEDA or the Qmate device, we'll get a rapid rise in progesterone. This will prevent animals from coming in heat or prevent ovulation while the device is in place. When it's combined with an injection of estradiol benzoate, both progesterone and estrogen will have a negative feedback effect on the hypothalamus and suppress GnRH secretion. This will cause a reduction in gonadotrophin secretion, and so we'll get atresia of existing dominant follicles, and we'll get synchronous emergence of a new follicular wave about 3 to 4 days after injection. And by the time we get up to day 7 or 8, we'll have a newly emerged dominant follicle. If we give an injection of prostaglandin, we'll remove any corpus luteum that happens to be present. If we remove the device, both removal of the device and injection of prostaglandin will cause a decline in plasma concentrations of progesterone. Cows will enter the proestrus phase of the cycle, and about 24 hours later we'll synchronize ovulation by injecting estradiol benzoate, In the presence of low concentrations of progesterone, estrogen will now have a positive feedback effect on the hypothalamus and stimulate the release of GnRH from the surge center of the hypothalamus, and this will result in a surge release of luteinizing hormone, and ovulation will occur somewhere out here. So if we inseminate the cows either on detection of estrus or at a fixed time out at this point here, then we would expect some reasonable pregnancy rates. So that's how that protocol works physiologically. This is some research results that I collected a number of years ago using that protocol, and this was a data set from a fairly large number of cows. The percentage of cows that were detected in heat within 5 days or 4 or 5 days of using that protocol was close to between 90 and 100% of animals in those dairy cows were detected in heat, which is a high percentage. You can see that the percentage detected in heat was slightly higher in the cows that were undergoing estrus cycles at the start of the protocol compared to cows that were non-cycling. If we look at this particular herd here, we were able to divide the cows into those that were cycling, those that were anestrus but they were still ovulating, but they weren't showing signs of heat, and cows that were not showing signs of heat and were not ovulating. You can see that these cows, the estrus detection rate, or the percentage of cows detected in estrus, was lowest. So you can see that cows that are not cycling, you can induce many of them to come in heat, but you'll get a reduced response compared to animals that are cycling. This is another example of a similar protocol, but instead of injecting estradiol benzoate, we're injecting GnRH. So in this protocol here, we're inducing ovulation with GnRH, and so we'll get new wave emergence occurring within 1 to 2 days of injecting GnRH. Here's our intravaginal device that prevents ovulation while that device is in place by releasing progesterone. We'll have a new wave coming up about here, dominant follicle present. We'll give prostaglandin to get rid of any endogenous production of progesterone, remove our device so we get a decline in concentrations of progesterone, wait approximately 48 hours, 36 to 48 hours, give an injection of GnRH here, and then we'll inseminate all the cows the following morning. And that will force ovulate the cows by injecting GnRH 36 to 48 hours after removal of the device. Alternatively, if you wanted to save a treatment, so if you wanted to inject this product here and AI at the same time, that can be done to try to remove the added labour of having to, if it was a beef herd, get the cows in an additional time. Pregnancy rates can be slightly reduced with that protocol. Sometimes not. In some studies they're not reduced, but theoretically you may reduce pregnancy rates just a little bit by doing that. The reason being is that because your semen is present in some of those cows for up to 24 hours prior to ovulation, so the semen's getting a little bit old. Whereas in this situation here, you're setting the cows up to ovulate before you AI. So by the time you come to AI, the time to ovulation will be less. These are some examples of protocols that are used in heifers. This one has happened to be called a co-sync protocol. Co-sync, in this protocol, the use of the word refers to GnRH and AI occur at exactly the same time. So again here, injecting GnRH to synchronize new wave emergence, CEDA to prevent ovulation. The presence of progesterone will also help stimulate non-cycling animals to ovulate. Prostaglandin to get rid of any endogenous production of progesterone. Progesterone declines here, animals go into proestrus, and then we synchronize ovulation with an injection of GnRH and put our semen in. This is a slightly different protocol. Here, instead of giving one shot of prostaglandin on day 7, this is a slightly shorter protocol, but we're giving 2 injections of prostaglandin 8 to 12 hours apart here. Now the reason for this is that the odd animal, if they've got a 5-day-old corpus luteum, then most of them will respond to a single injection of prostaglandin, but some won't. you can increase the rate of luteolysis by giving 2 injections 8 to 12 hours apart, and that's the reason for the 2 injections of prostaglandin here, to try to increase the percentage of cows that or heifers in this case, that are undergoing luteolysis. And the interval to AI here is about 60 hours, and we're giving GnRH at the time of AI. You could give this GnRH 12 or 16 hours prior to AI, so you could do that as well. This is the similar protocols, but this time in cows, and you'll notice here that the interval to AI and forcing ovulation is just a little bit longer. So you see here in the cows it's day 10, and here in the heifers it's day 9. This protocol, it's day 7 in the heifers and it's day 8 in the cows. It's a 5-day protocol as well. The reason for the extra day in the cows is because cows take just that little bit longer to come in heat, take longer for the follicles to mature to get to an ovulatory stage. So that's why the protocols are just a little bit longer in the cows compared to the heifers. Just want to mention briefly the use of melengestrol acetate, which is an orally active progestogen. This is a progestogen that is fed orally to cows in the feed. It's not available in Australia, so I just mention it because you may read about it. I don't expect you to know too much about it, but it's like progesterone that you give orally. It's used in some places in the USA. It's quite cheap, costs about 2 cents per cow per day, and if the cows are being fed in a feedlot or being fed a total mixed ration, then it's convenient just to mix a bit of this in, and it will prevent estrus. It's used in feedlots to suppress estrus so that animals are not showing heat, but it's also used to synchronize estrus, and there's a range of protocols that are available. Again, I don't expect you to know these, but these are just some examples of some synchronization protocols that utilize the orally active progestogen MGA. Again, not present in this country, but just wanted you to be aware that it is available overseas, in case any of you happen to work in the US or you happen to read anything and come across this product. Again, these are just some more protocols using MGA, and there are others as well. I don't expect you to know these. So that's a quick snapshot of protocols that are using progesterone releasing intravaginal devices to synchronize estrus. So what is the name of this device? What hormone does it release? How long could you consider treating cows with it for? What treatment could you give at the time when the device is inserted? What treatment would you give at the time of device removal? And can the device be reused? If so, how could you disinfect the device? See if you can find the answer to these by going back through the lecture, and I'll pause for a moment and then I'll work through the answers. This device is known as a Q-mate device. These silicon impregnated pods contain the hormone progesterone, which are released into the vagina of the cow, and they're absorbed into the bloodstream of the animal, and they effectively help to suppress estrus and ovulation while they're in place. What hormone does it release? It releases progesterone. How long would you normally treat cows for? Generally we treat for about 7 to 8 days. If you treat longer than that, you run the risk of getting an aged follicle, and that can decrease fertility. You can use older protocols. I won't go into it here, but there are ways you can get around that by administering treatments to synchronize new wave emergence, but I think that's beyond this course, so I won't go into that. What treatment do you usually give when you put these devices into cows? Well, you usually include a treatment to synchronize new wave emergence, so that's either an injection of estradiol benzoate or an injection of GnRH. Just remember that estradiol benzoate is not permitted to be used in lactating dairy cows. What treatment would you give at the time of device removal? Well, when we remove these devices, we want to get concentrations of progesterone to decline to basal levels. In order to do that, by removing the device, that will cause a reduction in progesterone, but if there's a corpus luteum present, that will maintain high concentrations of progesterone. So we give an injection of prostaglandin, F2-alpha, when we remove the device, and that will cause a decline in progesterone from any corpus luteum that might be present. Can the device be reused? Yes, they can be reused. They can be reused generally once, in some circumstances twice. How would you disinfect the devices? Well, we can chemically disinfect them with something such as Virkon or bleach. We tend not to use, I don't recommend the use of soap, because in case you remove some of the hormone. But you can also autoclave them. That's probably the best way of doing it, but it's not practical if you've got hundreds of devices to disinfect.